All right, welcome back. I hope you're having an awesome time so far. Our next speaker is Deepthi Bathina. She is the Chief Clinical Product Officer of Humana. Please join me in welcoming Deepthi to the virtual stage.
Hello, everyone. As Patricia just mentioned, I'm Deepthi Bathina, Chief Clinical Product Officer of Humana. I'm delighted to be with you today. Depending on your background, you may be an expert at AI or maybe new to AI. Similarly, you may be an expert or new to the concept of social determinants of health. Today, our spotlight topic is going to combine both of these. I'll share some insights about how AI can help people who experience loneliness. Based on our experiences at Humana, we have seen encouraging leading indicators about AI taking on loneliness, and I am thrilled to be here with you all today to share more about my learning. So, what are the social determinants of health, and most importantly, why do they matter? The social determinants of health are social and human needs that are not being met. In other words, as per the simple definition of CDC, social determinants of health are conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. There are many of those, but with the goal of increasing the number of healthy days of all our members at Humana, we look at these 7 aspects and their effect on healthy days. You've heard me use the word healthy days multiple times so far. As per CDC definition, it's the number of days where an individual is not experiencing physical or mental health problems. So if you look at the screen here, a few important ones. Financial strain. It's a struggle to afford the basics like rent, food, and medical care. You see, loneliness happens when people lack the opportunity to socially connect with others. Think of a 90-year-old grandmother in the pandemic whose church has been shut down, her community activities are closed, and her family is not able to visit her. She may feel lonely and isolated with nowhere to go and with no one else to see. Food insecurity exists when you can't afford nutritious food or you can't access food. That 90-year-old grandmother we spoke about as an example may not have the transportation to get to a full-service supermarket, or she may even fear getting COVID if she goes to the store. Housing quality and housing insecurity is very stressful. It involves many things, including from living in a structurally sound home to having air conditioning or lead in the water. You don't necessarily have to be homeless. Your housing situation could be unstable, forcing you to move from one friend to a relative's house or another without a permanent place to stay. Utilities issues occur when you can't afford to pay your electric or water bills and worry about your utilities being turned off. And then there are also transportation barriers. You may not own a car or just may not find a way to get around. You may also not live near accessible public transportation. If you're disabled and need a wheelchair, you may not have access to transportation that can actually accommodate you. And recent studies from Modern Healthcare actually estimate that these social determinants of health can be responsible for up to 80% of the health outcome in the United States. Think about that. Based on the data of Humana Medicare members, we know that when human and social needs are not being able to met, this results in more hospitalization and emergency room visits. And you know no one loves to go to a hospital. There can be more doctor visits and more medical procedures. This leads to higher costs and worse outcomes for the population we serve, less likelihood that someone experiencing this will not be able to lead their best possible life. 53% of Humana Medicare members tell us they have at least one social need. Of those members, as you can see on this graph, most experience financial strain. The second highest percentage feel lonely or isolated, followed by food insecurity and the others. And Humana gets deep into the data to understand more. We're going to laser focus today on loneliness because as the COVID-19 pandemic grew in 2020, our studies of our members show that loneliness was the only social need that increased among Humana members, from 29% in early 2020 up to 33% at the end of 2020. Quarantine has been difficult on our seniors. Visits with family members were extremely limited or could not happen at all. Houses of worship were closed, social activities were canceled. The impact for many was devastating. Loneliness is a key social determinant of health, and many of our Medicare members already lived alone even before the pandemic, and with restrictions, they felt they lost the connection to the outside world. Let's look at the numbers here. 29% of Humana Medicare members reported feeling lonely by the end of 2020. 9% tell us they felt severely lonely. According to some good studies on loneliness and seniors, endorsed by National Institutes of Health and Studies in Denmark and Great Britain, those who are lonely are 4 times as likely to be rehospitalized within a year of discharge, 64% more likely to be at risk for dementia, and 3.4 times more likely to suffer from depression. That's why Humana insists on understanding each member deeply. Every member gets what we call a longitudinal human record. This includes their physical and psychological health history and what we call a member-level social health record. The social health record tracks what members are experiencing over time. How is their life changing is going to be tracked as well. And this is where the social determinants of health come in, again, with screenings that we use to build predictive models for AI. Before we can provide members with the best possible care, we must make sure their fundamental needs are met. That brings us back to social determinants of health and identifying needs that are not met. To understand this point in a deeper way, let's look at 2 women with similar health issues and the question of who needs help first. That's where artificial intelligence comes in to predict the unmet social needs of a member, preventing her from refilling her prescription. The social health record I mentioned earlier includes information both on what members self-report and what AI predicts. AI predictions are based on claims data, member demographic data like age, income, where they live, etc. Look at these examples for now. Jane is 77. She has heart disease and diabetes. She went to the emergency room 8 times in the past 12 months. As a widow, she lives alone. As per Humana's data, Jane is not experiencing loneliness, financial insecurity, or any of the other social determinants of health. If you look at Betty, who's also 77 and has many similar conditions, but based on Humana data, we know she experiences loneliness and food insecurity, having to worry about not having enough to eat. And based on this data, we can get smarter and know that unlike Jane, who does not experience social determinants of health, Betty will be able to unable to focus on her health needs. Feeling lonely and isolated She may not be able to focus on renewing her medication, which will lead to more hospital visits, higher costs for her, and worse outcomes for members like her. The answer is we reach out to Betty first, whose emotional and financial needs are not being met. We need to make sure she has the support she needs to refill her, say, $75 a month in medications that control her heart condition and her diabetes. Again, we made this determination based on member self-reported data and based on what AI predicts using claims data and member demographic data, including age, income, locations. Again, leveraging data is how we get smarter. Utilizing artificial intelligence at Humana, we analyze the data, recognize patterns, and prioritize what to address and how to best address it. We integrate social determinants of health into care management. First, we identify every member's social needs through screen results, predictive models, dialogue, and risk assessments. Say the member is lonely, we intervene with products based on his or her preferences and comfort with technology. At Humana, we are proud of our portfolio of products and solutions to address members experiencing loneliness. Today, we focus on Medicare members. Technology-wise, it is absolutely essential to meet our members where they are. That's why Humana develops products across different types of platforms. We know most seniors are very comfortable with television. Our television-based products offer live and on-demand content, enable seniors to socialize and participate in activities with other users, and offers AI alerts when it's time to take medications or see the doctor. For those comfortable with smartphones and apps, like my mom, it's a good example, we have app-based products providing live connections with peers who know what it's like to feel lonely. We offer goal-setting programs and coaching. There are many lonely seniors who benefit most from in-person human contact as well. So we have products who suit such population as well. Our in-person based products are programs that connect members with college students who we call grandkids on demand. There is personal and group coaching, health education, social activities as well as part of that product. So you get a feel for different types of products we offer to meet members where they are and where their preferences are. Here's some data on an in-person pilot product with proven results, or I should say proven leading indicators of results to be technically right. Our product partner reported that Medicare Advantage members saw a 43% decrease in hospital admissions, a 48% decrease in hospital bed stays, 16% decrease in emergency department use, and a 45% increase in getting preventative care. These are not just members, they actually reflect better health outcomes and better quality of life for real people. So when Humana gets smarter, Humana's members get healthier. Remember the example of our member Betty, who we introduced you to earlier. She has a history of heart disease, is diabetic, lonely, and can't afford the food she needs. By investing in artificial intelligence and processing data on the social determinants of health, we improve Betty's quality of life. Humana provides her with a personalized loneliness solution based on her own comfort zone to reduce her loneliness, whether it's a TV or an app or an in-person social contact. We meet her other social needs like food insecurity as well by connecting her with a local senior center and food bank to ensure she has enough money to cover her prescription copay each month. If Betty gets her medication, she avoids visits to the emergency rooms and hospital stays, and we have driven subsequently better life experience and better health outcomes for Betty. More Betty days more healthy days for Betty, which is awesome. And thank you for letting me share some of these insights with you all today. Clearly, AI takes on loneliness in a very meaningful way, and we are very proud of the progress we are making at Humana. Thank you.
Awesome. Thank you so much, Deepthi. If you could stop sharing your slides, I know the audience wants to give you a huge virtual round of applause. Thank you so much. We really appreciate you sharing these insights with us. For the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and take some time to check out our amazing AI exhibits. Thanks so much, and we'll see you around.